Hello everyone. Today I know we all are stuck in a very pandemic situation, which is COVID-19. It's all over the world and it's so scary and it's something that we are all going through. Today my topic is about the COVID-19 in Afghanistan countries that does not have good resources or hospitals and a good government to take care of the situation. So, COVID 19 in Afghanistan, the Ministry of Public Health has confirmed 1,486 cases across all 34 provinces of the country. These are the people who are affected with the COVID 19. And for a country which is financially challenged, and this type of changes or virus is a big issue because the government cannot support the people to continue the current situation in Afghanistan, and all the people, like around 95% of the people, are daily wages. They are working every day and they have to just support themselves and their families. So far, many people died due to the COVID 19 because of not having good hospitals and doctors and resources. Many of these patients were underlying diseases, the most common of which are diabetes patients. The majority were between ages 40 to 69. Men were the most major part of the people who were affected with the COVID 19. And we could say around 300 people so far died back in Afghanistan, while 30,000 diagnosed with testing kits, and all of them have been checked so far. Cases are expected to increase rapidly over the weeks ahead as community transition, creating implications for Afghanistan. And Kabul is the most affected part of the country. Kabul is the capital of Afghanistan, and this place is the most affected part of the country. The government has a big concern about the spread of this virus back in Afghanistan because people cannot stay at home. They have to go out, they have to work in order to support themselves. So when they are going out, when they are not following the rule, here is the thing happens. The virus is spreading rapidly and it's just going further and further and it's getting larger day by day. As of April 2020, now we are Afghanistan is trying to find places where they can afford patients to be tested, to be cured for this virus. And we have many hospitals that they are working on this issue. Not only the hospitals, we have got some historical places that now turn into an isolation facility now, with more than 200 beds for the COVID 19 infected patient. Um, but the place which sits directly across from the Afghan parliament from now on will serve as a hospital until the virus is wiped out of the country, because there is no places to have hospitals for such a patients. That's why the Afghanistan is now using historical places uh, to to treat the patients. Uh, the current situation of Afghanistan with COVID 19 Now that this country is seeking help from the other countries, because Afghanistan health system racked by decades of conflicts and under resourcing is not equipped to deal with the virus on its own. Children are particularly vulnerable to crisis, especially to the millions who are already living in poverty, especially the families who are living in camps, or they're homeless, they don't have food, and they don't have resources to deal with the virus. So now Afghanistan is in a situation who are seeking help from the international organizations and from other countries to be able to deal with the virus. So stay safe, take care, and are I hope you guys are healthy.